Tougher challenge, training for a race or coaching a youth team?
Training for a race.
Why?
Because it physically hurts.
That's a good answer. Hello and welcome to Off Script. Here at Oswego Health, we like to take you behind the scenes with the healthcare team that takes care of you. And today, I am super excited to have with us Helen Williams. Helen, thank you so much for joining us today.
Sure, no
All
problem.
right. I promise I'm going to try to keep us somewhere on track between the guardrails so there's no injuries, so nobody needs any braces or any casts. That's my first lame joke, which I hope you've laughed a little more at. But take a little chuckle. I appreciate the chuckle. So here's how it's going to go. I'm going to start out with a question.
Okay.
And then we're going to see where it takes us.
Okay.
At the end, I'm going to ask you some rapid fire questions. So if you survive through that, which I know you will, then remember the items we asked you to bring in.
Yep.
We'll discuss a few of those.
Okay.
And then if you graduate from there, you then get to ask me a question.
Oh, okay.
Anything's on the table. Are you ready to go?
I'm ready.
Let's go off script.
Okay.
First question.
Yes.
We talked about it a couple weeks ago, and I'm really excited to learn more, especially the conversation we had earlier about the difference between cycling and bike riding.
Okay.
I know you have a big event coming up in August. Please tell us more about that.
So the I believe it's New York Parks program has a couple rides. One is across the Erie Canal from Buffalo. I believe it's all the way to Albany. And then the second is the Hudson Valley. So you go from around Albany, Troy area down to the city, to New York City. So I am opting for the second because it's my first time doing it.
It's a nicer ride.
So I believe it's about 300 miles. It's about, it's less than 50 or maybe up to 50 each day. And so, yeah, the biggest difference between cycling and biking, in my opinion, cycling is very serious, right? Very competitive. This is more of a leisure ride. So a ride that you're accomplishing, right? And seeing the sights, of New York as opposed to you're trying to win it, right?
So not the Tour de Hudson Valley.
Yes. Or
So
just
great.
the other version of tour. You're touring the Hudson Valley versus.
I wish I could do it. It sounds fantastic.
Yeah, I there was a patient years ago that had done it, and I was like, that is really neat. I didn't know anything about it, so I researched it, and I got my bike the end of last summer, and I've been training all winter, so we'll see.
What kind of bike is it?
I have so the female version of Giant is Liv, so I have a Liv bike.
I used to have a Cannondale way back when.
Okay.
Oh yeah, big time.
I have one in my shed.
Yeah. I guess that's what the word now.
Yeah.
My uncle, he used to be into cycling.
Okay.
He was big time, and he got me that nice. It was a nice white and green Cannondale bike.
Nice.
I was like, oh boy. We went out once. I thought, this is not that fun. So once and done.
It's hard. Yeah. And the nice thing too, like a lot of this is gravel true. So I have a gravel bike. So it's something that you can kind of use on any terrain as opposed to the super thin tires of a cycling bike, where it's more, again, competitive and, the sleek helmets and all that. This is more like leisurely.
So you drive by any of the locks?
You mean like on the
canal?
Yeah, I believe so. Yeah.
Very cool.
Yeah.
I hope to hear exciting things in August.
Yeah, me too. I hope to survive it.
You more than likely will. So what I want to go to next is, we talked a little bit about the bike riding. Tell us a little bit more about Helen Williams outside of the clinic.
Okay. So I have 3 kids. My oldest is in college, sophomore. I have a daughter in high school and a second grader.
Fantastic.
So they consume almost all of my time outside of work. Yeah. So, yeah.
I can totally relate. I have 4 horses and 2 dogs.
I have 2 dogs as well. Yeah.
There you go. I mean, what kind of dogs?
I have a chocolate lab and a monster.
Wow. Yeah. Very nice.
Yeah. My monster is a mini labradoodle.
Oh.
Yes. He has many names. So
What are some of them?
Master Shredder, Max from The Grinch.
Yep.
His real name is JJ, but yeah, Monster is usually what he's called most days.
I would take Max from the Grinch because he was just the coolest dog.
Yeah, he has the spiky
Does
hair
he?
just like it. Yeah.
That's fantastic. So your background is rooted in athletics and performance training. When did you first develop an interest in sports and fitness?
I was an athlete, probably competitively starting around like junior high school.
What sports?
Did a little bit of everything: soccer, basketball, track and field, softball. And then when I got to high school, geared more towards track and field. In high school, I was a very good discus thrower. And then in college, I was a 2-season athlete in outdoor track and spring track. And there I picked up the hammer throw.
You never hear hammer throw around here anymore. Wow.
Yeah. So
Yeah.
in most high schools, I think the exception was Rhode Island, and it was another New England school or state, excuse me. You could do it in high school. Everywhere else, the liability insurance was too high. So what's kind of nice is everyone, for the most part, is learning it in college. So you're kind of all on the same playing field.
I had no clue. Is
Yeah.
it similar to what javelin's like too?
No, a lot more states offer javelin, so more kids know how to do that. I
Really?
mean, but you're correct in that the liability insurance is high for kids throwing spears. Yeah.
I remember when I tried out for track way back when, I go, javelin. And they go, Mike, absolutely not.
Why
There
not?
is none in New York State. I go, well, come on. I feel like I can throw.
Yeah,
pretty
see, I
good.
grew up in New Hampshire, so they let us do it.
So you played a lot of sports when you were younger.
Yeah.
I know we'll dip into this a little later, but since you opened the door, I will go ahead and walk through it.
Yeah.
The difference of today, we have, young athletes that are specializing much earlier. Talk about some of that with me with injuries.
So really what's happening is you're moving more towards model of club sports. They're also still playing sometimes at the high school level, but yeah, they're having early specialization. And so what happens then is, in essence, they're using the same muscles over and over. And so there are imbalances that are created. If it kind of makes sense, like if you're a baseball pitcher, that same motion as you're throwing creates strength in other areas and weaknesses in their opposing. And so that's where a lot of injuries occur. Probably the more common thing that I see is that kids are playing sports all year round, but they're not doing the strength training to supplement what they're doing. And so what we see in kids is a lot of leg weakness, core weakness, because they just don't have the strength that they need to avoid some of these injuries and fix some of those imbalances.
And you come from a sports, fitness, and strength conditioning background.
Yep. Yeah. So I went to school for athletic training. So athletic training is the medical staff that runs out on the field when an athlete goes down, assesses the situation, and then provides care. And when I was in college, my sophomore year, I realized that while I really enjoyed that aspect of the field and the profession, I wanted to do more to prevent injuries from happening. So I concentrated in strength and conditioning. And so when I came out of college, I was dual certified as an athletic trainer and as a strength and conditioning specialist. But I kind of pursued the strength and conditioning field, not so much the athletic training. But I mean, I still kept those skill sets, because part of that was evaluating injuries all the time. But the strength and conditioning was more understand the sport, the demands on the sport, and then how do we, one, replicate them in the weight room and then fix those imbalances.
Which from my perspective, gives you a real holistic view with your job today, working in orthopedics. Yeah. Because it's not just correct me if I'm wrong. It's not just evaluating the injury. You truly can think about, talk about how it happened and how you can fix it and how you can prevent it again from happening.
Yeah. And when I am with patients, I often will explain, the anatomy, what their injury or what their problem is, and share with them that injuries usually happen for one of two reasons. One is an acute fall, slip, on ice, snow, or whatnot. And then the other is repetitive use with imbalanced posture, sometimes poor posture, right? And so I often will say that there's a way to treat this and then there's a way to fix this. So treating it is helping you to feel better today, either with medicine, or a brace or whatnot, but fixing this is actually figuring out what those imbalances are and either doing the strength training on your own, going to the Y or going to a facility where you have somebody that can work with you, or going to physical therapy.
Awesome.
Yeah.
So continuing with strength and conditioning a little bit, I know Syracuse University, you used to work there. We share that.
Yes.
That's awesome. I love that. That's one of the many things that we do share, which is great. Tell me a little bit about that experience working at SU.
Sure. So when I graduated college, I worked for the strength coach of the Boston Bruins at the time, out of a private facility in Boston area. And we trained junior high school all the way through Olympic athletes. And so it was a great experience. And from there, I took a job at SU. I was an assistant strength and conditioning coach for several years there. I worked with 8 of the athletic teams doing preseason, in-season, and postseason lifting, conditioning, all of that. So keeping them healthy, in sport, and then obviously making sure that we were correcting or fixing those imbalances out of sport.
That's so cool. Tell me a little about the transition from strength and conditioning into healthcare. So later in your career, you decided to pursue becoming a physician assistant.
Yep.
Earning your master's degree from SUNY Upstate Medical University in 2023. So what inspired that transition?
So I left collegiate athletics. I always kind of kept some component of it, but I started working with the general population as well. I found that I really enjoyed that. And the more that I was working and developing my career, there were other components. So in particular, let's say I had an individual that I was working with that had Parkinson's or had a recent cancer diagnosis or, had a history of a kidney transplant. So there were other components of their healthcare that I needed to incorporate into our training. And there was a small gap in my knowledge. And I also realized that I wanted to do a little bit more. And I was unfamiliar with the profession. It's still a newer profession for me. When I was in school, I don't think until my senior year in college, I had met somebody in the summer when I was there training for track. And I was like, oh, what are you still doing here? And he said, oh, I'm doing my clinical rotations. And so we chatted, and I didn't know that the profession, existed. So it was something I learned about later. And I have a few friends in my community and where I live who practice and who encouraged me to consider it. And so I did a lot of research, looked at a bunch of different professions, and it was really important to me that whatever I did, it built on my experiences and didn't kind of push them aside. So I went into the program at Upstate with, open eyes and willing to study any field and pursue any field of medicine, which is one of the great things about physician assistant is you have a lot more flexibility. And orthopedics was obviously very natural for me to start because I wasn't starting at the ground level. I was starting already with 20 years of experience of evaluating injuries. So,
yeah. What's the main difference between working with, high level athletes and then working in a clinic?
They're pretty similar.
Pretty similar.
Yeah.
Oh, that's great.
You're helping people. Yeah. So they just have different goals. So maybe instead of the goal being to increase a vertical jump or avoid a knee injury in basketball, it's being able to take the laundry up and down the stairs or put the dishes in the top shelf. So regardless, it's helping people to feel better and to do more and to increase their activity. So I would say, believe it or not, it's pretty similar.
That's a great answer. I love it. I had the opportunity of witnessing you work with a patient. My wife came in to see you. It was fantastic. You're able to simplify things to make the common individual understand what very technical terminology is. Very, very simple. Explain to me and the viewers, a new patient coming in to see you, Helen, what are they going to expect?
So generally I start with, what their story is. So believe it or not, a lot of your injury comes from the words that you share, and the story that you tell. So how did the injury happen? How long has it been going on? Where is the pain? What are your limits in range of motion? What are your limits in activity? Is it something that's with you every day? Or is it something that's very specific to a movement? And so we have a pretty lengthy conversation about what exactly is going on, what happened. Also, what have you tried, right? What's been successful in alleviating your symptoms? What hasn't been? And, if this is affecting your activities of daily life, is it affecting your activity, your work, or, your hobbies, whatnot? And then we generally do a physical exam, checking your different structures to see, on your anatomy, what hurts and where does it hurt. And then checking your range of motion, checking your strength. And then we have what are called assessment tests. So assessment tests are tests that look at specific structures. So a specific ligament, a specific muscle, and asking that to do its job. And if it can't do its job, then it tells us that it's most likely injured.
I felt so bad when you were doing the exams. Like, oh, geez, Nicole, so you did an amazing job. What I love most too was at the end, the options, and you said every single option that was available. I'm speaking for you. I apologize, but
No, it's
explain
okay.
more about that.
So after we do the physical exam, after I've gone through the history, I'll generally sit down with each of the patients. I have a lot of anatomy structures and posters on the wall. I'll explain to you, what the likely injury is, where it is in the body, why this has happened or what's hurt. And then, the different ways to make you feel better, and ultimately maybe to fix this, maybe not. So we'll talk about, how do we help you feel better today, or what bracing could we provide you with to make you feel a little less pain that you're having right now. Or is it necessary that we maybe do another test because you're coming in and it could be one thing, but it also could be a second thing, or it could be a third thing. And depending upon the severity of that, it gives you peace of mind to know, and that it better helps us to direct, our treatment plan. And then, the other option is always to do nothing, right? So, some people come in and they say, I'm not interested in surgery, or I don't really want to, have an injection, or I don't want to have medicine, but I just want to understand what's going on. So I always say to my patients that, my job is to educate them and to provide them with choices and options, and their job is to make choices.
And you do an amazing job
Thanks.
of it, right? So going into more of the clinic work, why did you choose Oswego Health?
There are lots of different ways to practice medicine. And I was looking for a community, as well as a practice and peers that work very well together as a team, where communication is easy to exchange. If I have a difficult scenario, I have a colleague that I can immediately go to and say, there's something that I don't like about this particular injury. Something seems off. So I really enjoy the team that I work with, the support staff there as well. And also, I think some hospital systems and some practices, both for the patients and for the providers, can kind of feel like fast food medicine, where, you maybe only spent a very short amount of time with the provider or with the patient. And at least, for our practice, I can practice and see patients the way I believe medicine should be practiced, where it's a little bit more time when we're first meeting each other. Maybe for follow-ups, it's, a shorter visit, but for the most part, the first time you and I are meeting, we have a little bit more time together. So that was really important to me, to find, a practice that sees that as very important, and supports that.
Perfect. Which explains to me why, again, I don't know your record as a coach, but I'm sure your record is amazing, right?
I don't know. I don't really keep track.
So tell me a little about, I know you coach basketball, you coach soccer. Tell me a little about that.
Yeah, so I have 3 kids, like I said. It was pretty difficult to coach the older ones' activities and sports. But again, with my background, it's very much fundamental skills. And so I started to get pretty frustrated as the kids were getting older and they're playing sports and they still just don't have some of those fundamental skills like dribbling, with their eyes up, not their eyes down, passing, like, and understanding the sport. And so my little guy, he is 8. And so I think it was 2 years ago, I was like, okay, fine, I'll help, I'll coach, because it's a big commitment. And so I coach right now soccer and basketball. So my first year was first and second graders for
wow.
soccer. So 2 years there, and then
The cluster around the ball, right? Prevent that.
yes, yeah. So it's always I am probably yelling 100 times on the field. Find space, find space. So try to teach them the triangle. So if this person has the ball, the 2 of you closest to that person should be more like a triangle and not all on top of each other. So I coach right now just in our community soccer and basketball. And then years ago, I used to help with the swimming program. So
Really?
for strength and conditioning, not head coaching.
So have you ever pulled into double duty where you're coaching, but then there's an injury and they're like, Helen, help us out?
No, I don't think most people know what I do.
Oh,
Yeah.
okay.
So I've had a couple like fingers during basketball, and I'll just assess them and I'll be like, yeah, you're okay. Just take that.
That's great. That's so good.
Yeah.
Oh my gosh, it's so good, so good. So orthopedics is really about helping people stay active and mobile.
Mhm.
What advice do you give, patients who want to stay active as they get older?
I think most are. When I see them, usually it's something that's impacting their activity level. So they used to walk further, or they used to do more, but there's something that's stopping them from doing that. So I would say we're always encouraging you to stay active and to stay exercise, but more importantly, it's the right type of activity. So maybe you have advancing osteoarthritis of your hip or your knee. Running is not going to be recommended, right? So it would be, can we change maybe the activity that you're doing to incorporate bike riding, cycling, or swimming, or other components that are non-weight bearing, but still keep the joints healthy. So I would say, our role is probably more in helping you get back to either the activity that you're already doing or expanding your horizon to maybe try some other activities.
Cool. Helen, we now got to the rapid fire questions portion of our off script session.
Okay.
Are you ready to go?
I hope so.
Deep breath. These are
Okay.
going to be tough.
Okay.
Okay. Tougher challenge.
hmm
Training for a race or coaching a youth team?
Training for a race
Why?
because it physically hurts.
That's the good answer. Do you ever watch people at the gym or while you're coaching and want to correct their form?
I would never do that, but yes, I would like to very much. For me, the hardest thing is watching people walk and run and like driving by, and you're like, oh gosh, you're gonna have knee problems in like a couple months.
So is it often?
Yeah,
Yeah.
yeah. But no, I would never say anything out loud. No.
Watching.
Only if they were gonna
sorry.
drop something on their head, then I might. Yeah.
I cut you off, so
No,
feel free
that's
to weigh in.
okay.
So,
Yeah.
watching a game, fan or analyzing injuries?
Fan.
Fan. Who's your teams, by the way? I think I could guess. but
I generally don't. I just like watching everything.
I would
I
assume
really do.
New
Like,
England, Boston.
well, yeah, that's what I
Okay.
grew up with, but I will watch anybody.
Okay.
I frankly prefer if I know an athlete, then I enjoy it more.
This is to me the question I really, really want to know.
Okay.
Fresh powder or bluebird sky?
Fresh powder.
Oh, okay.
Because if it's icy in the bluebird sky, like that's still not skiing. That's
Well,
just
agreed to disagree. Yeah.
okay.
Do friends and family ask you sports injury questions all the time?
Occasionally.
Occasionally?
I usually have to force it out of them because they say something hurts, and I'm like, okay, tell me. And they're like, no, I don't know. No, tell me. I'll help you. Don't worry.
Most interesting injury.
Hmm. Ooh. I don't know that it would be the most interesting injury. It's more the complexity maybe of something that came in that was harder to diagnose and solve and fix. And frankly, that's a weekly or monthly occurrence.
I was just going to ask that. Yeah.
Yeah, we see a lot of complex things.
Makes it fun.
Sure.
Biggest myth about orthopedic injuries.
That all we do is surgery for orthopedic injuries. Yeah. We don't. A lot of what we do is preventative or conservative treatment. Sometimes, yeah, it does need surgery eventually, but not always.
You graduated.
Yay.
You made it. Yeah, there you go.
Okay.
So I asked you to bring in a couple items that represent you. So the first one, I think you probably know where I'm going to go to because I also share.
Okay.
And that is your ski helmet.
Yeah.
Tell me more about skiing.
So I've been skiing since I was probably in elementary school. I grew up in New Hampshire, and we actually had a very small mountain with like 3 trails in the city where I grew up. It was
in the city?
In the city.
Wow.
Yeah, it was managed and run, I think at that time privately, and now it's actually operated by the city as far as I know, or at least the past, 10 or 15 years. So we used to ski every Saturday and Sunday and sometimes Friday nights. So I was a big skier. And then obviously when I was old enough to drive, started to go to some of the bigger mountains, that are within about an hour's drive of where I grew up. And then went to college in Massachusetts, so skied some of the mountains out there. Obviously moved out here, so I ski mainly the local mountains, Song and Lab, occasionally Greek. I've skied Whiteface and Gore. And then my son is out in Colorado. So we've skied.
Yeah.
And so we collect stickers
Absolutely,
and put them all over the helmets. So
I put them on my skis.
Yeah?
Yeah, I'll put the stickers right on the skis. Yeah. So Stratton, we've skied.
Yeah.
And then where else on here? Gore.
Yeah.
That's my favorite in New York.
Yeah.
I think there's more variety.
Yeah.
Than
it's a nice
Face,
mountain.
even though I do like.
Yeah.
Last year it was the first time we went to Whiteface, and it was powder. It was unbelievable. It was a fantastic day because usually it's just ice.
Right.
Yeah.
Hence Ice.
Hence Ice Face. Yeah. What's your favorite trail?
Where?
Anywhere. Like your favorite trail to go down.
So at the bigger mountains, I don't really know the names of the trails because it's like, okay, get off and go to that one. I think it's called Long Something at Vale, and it's on one of the early back bowls. It's Long Something, and you kind of traverse the crossover all the way, and I love that trail. I would ski that like 5-6 times at least when we go there. So
to me, I like it because it's the closest feeling of flying I'll ever get. Yeah. Right? That's why I enjoy it.
If the conditions are good, I do like to ski fast.
Now we're talking.
Yeah.
Now we're talking. All right. So a couple other items. This first one is this photo, I believe, of your kids, right?
Yeah, that's my youngest son and my daughter.
Awesome. And again, sports theme.
Yeah, they both had, I think it was opening day at that time, softball and baseball. So just a fun picture.
San Francisco, and I'm assuming the S is for Syracuse?
Yeah,
maybe.
Yeah.
Oh, you're going to have to see you after. Like, keep bending over for that. Yeah. And then this photo here.
Yep. Sorry, it's got something on it. That's my son. He's a sophomore at the Air Force Academy in Colorado. Hence, some of the reasons that we've gotten to ski some of the mountains out there is, we go out and visit him and steal him away for a weekend.
Next time you go visit, I don't know how close it is. If you fly into Denver,
we do.
You can take the ski train to Winter Park. It's a train that just goes to Winter Park twice a day. That's one of my bucket list things I want to do. Yeah. Yeah.
I'll have to check it
Again,
out.
don't know how close it is to. Where's the Air Force Academy?
It's in Colorado Springs,
Colorado
so it's
Springs,
south
yeah.
of Denver.
So yeah, I don't think it's close, but
Yeah.
still, you should make time to do it.
Yeah.
Yeah. Helen, now that I was able to grill you with a bunch of questions,
Yeah.
it's your opportunity to ask me whatever you want to ask.
So I guess I'll ask you my.
You can hold the cards while you ask too.
Oh,
Dan, if you
yeah.
want to,
Well, I don't need the card.
You hold the
It will
card.
be-
Just
I'll
it
pretend.
feels
Yeah.
powerful. Yeah.
Off script. So oftentimes, generally because I am interested or I need to distract you during an appointment, because maybe I'm giving an injection or doing something that I need you kind of not focusing on, I will ask about a recent movie that you've seen, a series that you're watching, or a book that you're reading, for good ideas, for
Mhm.
suggestions. And it's always something I'm interested in. I love to read and I love movies and TV. So what movie did you recently see? Are you watching a series and are you reading any books?
The most recent, I guess, television series I watched, it was a couple weeks ago. I feel like I'm late to the show, but it's in the middle of the show still. Landman. I actually
Okay.
enjoy that quite a bit.
Yeah.
Randomly, we were at I was at my in-laws' house. We just finished with the horses, and I came inside and I was just flipping through Paramount, and I was like, oh, cowboy hat. This looks
All right.
interesting. I'll watch it. And then the first 3 minutes in, I'm like, oh, Billy Bob Thornton. Like, I'm in.
Okay.
Like, it was pretty good. And then season 2, I was like, oh my gosh, did I just binge watch something? Because
Yeah,
I never do that.
And how about any books? Are you a big reader?
My favorite book, it was I read it when I was in high school. I don't know why. Obviously, I mean, corny as it
We
is,
need to get you reading more if
No,
you're going to tell me the
I
last
love-
book you read was in high
I
school.
love reading. I love reading governmental transcripts.
Okay.
I love it. Right.
Okay.
But it's not the Constitution, the United States Archives, but for your question,
Yeah.
not a book, right? So my favorite book I've ever read was Moby Dick. Love
Yeah?
Moby Dick.
Okay.
And then the best book besides that was a book about it relates to you too because it's basketball.
Okay.
It's called Playing Tall. It is a bunch of autobiographies about the shortest basketball players ever to play in the NBA.
Right.
Spud Webb was
I was
always
gonna
my
say, he's
favorite
gotta be
basketball
on
player
there.
growing
Yeah.
up. Of course, Muggsy Bogues. Just great stories about how they overcame a lot of adversity and people saying, you can't do it. You can't do it. I always say because they're shorter, they had to be that much better
Of course.
than everybody else.
Yeah.
Yeah.
Good answers.
Good question.
Yeah,
I like
thank
good
you.
question. Yeah. Helen, thank you so much for joining me today. I feel like a high five is better.
Okay.
There you go. Helen, thank you so much for joining me today. This has been fantastic as usual. So this was Mike for Oswego Health and Off Script. We look forward to seeing you next time.